Welcome to This Can Happen conference and one of the two emerging issues sessions in this conference. Out in the open, the need to adopt a bold approach to suicide. Do send in your questions during the session using the chat box on your screen. They are anonymous. Hi, my name is Lai Chan and I am facilitating this session. I was the former Senior Assistant Director of Samaritans of Singapore, which is one of the pioneer organizations in suicide prevention and intervention work in Singapore for the last 50 years. I'm really excited to be part of this session because both in my professional as well as personal life, I have witnessed the devastating impact of mental health issues and even suicides at the workplace and in the community as a whole, even in a small country like Singapore. I have with me today a panel of experts who are here to share and help us gain insights in adopting a bold approach to suicide in Asia. We will also have an online Q&A sessions right at the end of the discussion. First, I'd like to introduce Dr. Paul Wong. Paul is a clinical psychologist and an associate professor in the Department of Social Work and Social Administration, the University of Hong Kong. He has been involved in suicide prevention research and mental health promotion and practice since 2003. Next, we have Vicky Skoji, and she is the Lifeline Services Director with TEL Japan and has a background in psychology and neuropsychology. Since 2004, she has developed a wide range of suicide prevention, mental health, and psychological first aid programs aimed at addressing Japan's high suicide rates and the stigma surrounding mental health. And we have VIESHAKA DUTTA. She is the Director, Inclusion and Diversity Publicist Sapien from India. Visha has also coached and supported people in underrepresented communities and facilitated community groups on social media. She is no stranger to business community as she is one of the finalists of the D&I Champion of Change Award in Community Business 2020 in India Best Practice Award. Thank you very much and welcome. According to WHO, over 1 million people kill themselves every year globally, and more than half of these occur in Asia. Suicide has since historical times been perceived as an act against most religions, cultures, and norms. Some countries in Asia have even listed a suicide attempt as a crime, and stigma is still prevalent. The good news is this is slowly decreasing. For example, like in Singapore where I am, Singapore has just decriminalized suicide just this last January. And that's good news for us. I'd like to kick off this session by exploring the specific cultural sensitivities around suicide in Asia. So, what are some of the specific cultural sensitivities around this topic of suicide in Asia? Paul, can you help us by kickstarting this discussion on this?
Right. Thank you. This can happen, and Lai Chung for the well done introduction of the three of us. Well, talking about suicide prevention in Asia is a rather complex issue because we do have a lot of countries with a lot of different flavor of cultures within this region. In particular, Hong Kong. Hong Kong is a West and East culture mixed city. So we do have the culture of the British government colony influenced like Singapore. But we also have the Chinese culture of talking about suicide. It brings bad luck to people. So I'm very fortunate to be invited to talk about these issues in this seminar, and I must say that the majority of the people who completed suicide in the world, many of them are actually from this region. So bringing this topic up front and we talk about this, it's utmost important that as a prevention perspective. Thank you, Lai
Right.
Chun.
Right, right. Yeah, in my work in Singapore, I've also come across families like what you just mentioned, Paul. They see suicide, of course, like something that is of very bad luck. Yeah. Vicky, we are very keen to hear from your perspective from Japan.
Mm. When we think about, thank you very much. When we think about suicides in Asia, Japan is one of those countries that comes to mind. It had one of the highest per capita in 2003. There was 33,000 people that took their lives to suicide.
Mhm.
That is 100 every day. This
Oh,
last year, that number's come all the way down to 20,186. That's about
right.
57 a day. While that's
Uh-huh.
still too high, it's come a long way. And that approach, that reduction has occurred because the Japanese government has put a lot of time and research into policies and studies looking at
Mm.
at-risk populations. But we
Right,
still have a
right,
long way to go because we haven't had that swell from the community where we've discussed the issue of talking about mental health issues and talking about stigma. So
right.
it's not just enough to do research in this topic. We also have to have communication and be willing to talk about it as well.
Right, right. I totally agree with you, Vicky. Yeah, it's so important to even talk about it. If we are not able to talk about it, then how can we move on to have people seek help and reach out for help? Yeah, Visha, it's from your perspective in India, uh, perhaps you can share with us the perspective from India.
Not very, dissimilar to what we heard before. We also had a law that criminalized suicide. So you could actually be taken or arrested for committing suicide or attempting to. However, what has happened is in the last few years, especially this year, I
Mm-hmm.
think with a lot of, different news coverage, and especially with one of our actors committing suicide, this topic is back on the map in every way. So we did have different news of suicides and mental health and in dire ways in the last few years, but this year I think this topic is back on the map. In the corporate
Yeah.
scenario also, I would be very happy to say that in the last few years I think we have started talking about mental health very
Mm-hmm.
much, and not just this year when it is really a cause of concern. It doesn't just have to be a suicide, but how you're generally feeling. You may have had bad news or not, but just the feeling that you're closed has challenged us mentally
Right.
and emotionally.
Right.
And unfortunately we are also seeing
Mm.
cases of suicide happening obviously in society and hence in within organizations, but the good news is that everybody's talking about it.
Yeah, it's sad that it has to take, suicides to happen before anyone is willing to talk about it. I think it's really sad. Yeah. I'd like to move this discussion into the business world right now. So what are the possible triggers in the business world that could lead to incidents of suicide? Yeah, Paul, I understand that you have done a lot of research and studies on this in Hong Kong.
Well, according to one of the earliest psychological autopsy studies that we did in Hong Kong
Mm-hmm.
during the SARS period in 2003, we found that unemployment, debt issues are very related to the suicides in Hong Kong. I can't say that it would imply to all different cultures and countries in Asia, but if we are talking about the business world, if people, especially during this pandemic period, if they are laid off, if they have issues about financial matters, that would create actually increased risk of completing or attempting suicide. So
Mhm.
this is one thing that I worry the most during this pandemic period.
Right, right. So a lot of people are facing a lot of crisis during this period of time.
Yeah, because people talk about mental illnesses and suicide a lot. That is understandable. For people
Mhm.
with schizophrenia and depression and whatnot, they are more prone to completing suicide. But it
Right.
is not so discussed about how people in the business world or in the employment world, that
Yeah.
when they lost their job, when they lost their dignity of being an employer, so that actually push people to think about suicide themselves.
Right, right. Yeah. You just like to just share with us something about the working hours in Hong Kong? I've heard that, yeah, the kind of
Well,
working hours could also be a source of stress.
well, working long hours is has been something so famous in Hong Kong that we are so proud that we work like 50, 60 hours per week.
Mm-hmm.
Something that was we were proud of, but when then lately learn from the Japanese culture, and we know that people who work long hours actually push them into a lot of stresses in life. And
Mm.
but even though we talk about that, but it's nothing much we have been doing to
Right,
reduce the working hours.
right, right. Yeah. Vicky, I know that you've also done a lot of work with the corporates in Japan. Yeah. So, so what are the possible triggers that you have observed?
Well, just like Paul was saying, in Japan, long working hours is something that has been shown to increase stresses and increase depression. And we have a term for it over here, and it's called koroshi, working to death.
Uh-huh.
And a number of companies have been sued because they have had young employees who have worked so many hours that they have taken their lives.
Right.
We've been doing a lot of work with companies at the moment because we're really quite concerned about the increased pressures that are being placed upon employees due to COVID-19. So we
Mm-hmm.
already had, or most places already had, about 1 in 5 employees in the workplace who have a mental health problem. When
Mm-hmm.
you think about that, the World Health Organization is now saying that potentially 1 in 2 to 1 in 3 of us has got an increased anxiety rate. So we're now potentially in the workplace, it could be 1 in 2 to 1 in 3 people have a mental health problem. So the
Mm-hmm.
ability to talk about this is going to be really critical, and how we
Right.
manage it is going to be really essential. There was a study done by the London School of Economics that looked at a number of countries in Asia, but in particular looked at one in Japan, and it said in 2016 that the cost of depression was around 14 billion US dollars, right,
Mm-hmm.
in lost productivity. Now, if we
Wow.
think about COVID and the extra stresses and challenges that that's placing upon us, what is the cost of that going to be on the businesses, right? So
Mm-hmm.
this is going to be a huge problem. And what we also know is that many managers don't have training or understanding on how to deal with this. So I think we've
Right.
got lots of issues coming towards businesses on many fronts.
Right. Yes, yeah. And it's very interesting you mentioned the word manage. It is about managing the situation. And you rightly point out that unfortunately, even in Singapore here, not a lot of managers are actually trained to handle situations like that. So they kind of feel helpless, or, the extreme would even be just letting an employee go without understanding what the issues are. Yeah, so that's really sad. Yeah. Visha, yeah, over in India. So, what are some of these triggers that you see in the business world?
I would like to say that suicide is not always about one incident and a trigger. It's generally a culmination of things that have happened over the years, right?
Mm-hmm. Certainly.
So, that is one of my understanding as a mental health professional, and being in corporate working on this subject for quite some time.
Mm-hmm.
I have to tell you, unfortunately, of a lot of cases within within organizations and ours and outside, not just my organization, but the larger DNI professionals group. This is what we see, that a lot of them do not show us very quick reasons for which it might have happened. The easier reasons are, what Dr. Paul said, but a lot of times they've just had like a closure of a day, and then they've gone home, and then the next day somebody's telling us that this is what has happened. And when we sometimes, of course, there are relationship stress, there is stress of how they perceive work is progressing or not, right? A loss of a something that they were truly expecting. Mostly it is about personal reasons and financial reasons being this thing. But I would personally like to say that I don't think we can categorize triggers for suicide as of now, or we've really been able to pull together a theme of sorts as of now.
Yeah, yeah. But we can see that there are some similarities of some of the possible causes, or what we call triggers. Paul has mentioned financial issues, and then Vicky has talked about also the fact that in a workplace, then there are long working hours. And I know in Japan, the Japanese are known as one of the most hardworking people around. And even in Singapore here, it's been found that an average Singapore employee works on the average about 45 hours per week. And that is in contrast to most of the other advanced economies in the West, where they work about like 35 to 40 hours at most. So as you can see that in Asia, that seems to be one of the very important factors that mental health professionals perhaps could look into, right? So we can see that there are some similar situations in Asia from all the experience that you have shared with us on some possible reasons that could lead to suicides in workplaces. So this leads us to the next question, which is so important. We know of the possible causes or triggers, but how can companies address this? I'd like to pose this question to VIESHAKA first. I know that you have some personal experience as well as professional experience in this situation.
Yes, so that is right. So I think I would like to say that not just in the organization that I currently work, Publicis Sapient, but in other organizations that I've worked before, we've had incidents either of a person who's died by suicide or of people who've shown some indication that they, they mean or intend to do self-harm, or maybe are thinking about it, etc. I also would like to say that it is very difficult to define one trigger of an incident when it comes to any case or incident or an individual like this, because my understanding over so many years within the corporate organizations and also as a mental health professional is it's a series of different incidents and causes, and the way they're perceived by the individual or the surrounding ecosystem that lead to somebody taking a step like this, right? A very recent incident in my organization is where a person was transitioning roles, and over the weekend, this incident happened where a person passed away, and we got to know the next week when the friends mentioned. It was very shocking because we had a farewell over the weekend, and the person was supposed to roll off. There was no such incidents of even showing that there was any distress, right? How the support system really kicked in is the first intuition, and the first thing that we did was to support the family, right? So we assured them that they can get counseling, and they can get any kind of help that they needed, and we would be supportive, right? So we ensured that the immediate family had what they needed, and we assured them anything else that they could have probably reached out for. We ensured that we would keep all the documentation and everything also, whatever they need for processing, because suddenly the family is like fumbling with a lot of details that they need to grapple with. Apart from that, the team that the person worked with, and remember there was a transitioning happening, so there was a change of hands, etc. So people who were close to this individual, people who were who had worked, we reached out to them to ensure that they had what they needed. Not everybody would like to get support. Sometimes people just need to absorb it, and they reach out with time as it settles down. But we ensured that this was spoken about. This was, we also had a organization-wide communication, sent out. And also with the details that, people who, remember these kind of communication also trigger, sometimes. So we had this information in these communication mentioned. So this is one of the ways, in a way, an organization, we all have a EAP system. So these are some of the ways that an organization can support individuals, their families, people who work with them, who are touched by that, that incident. It also happens that sometimes you would pick up some of these conversations in a one-on-one conversation, and we encourage people to now openly talk about mental health. We encourage individuals who are sensing that somebody is in distress to reach out. So we do have these, not just the EAP helplines, but our own headline, which is our BRG business resource group, affinity group on mental health, where we support individuals to talk about it and, help them out. So these are like, the most recent incident that I can mention.
Yeah, it's so important to reach out to suicide survivors, people who are left behind after a suicide, because that can be so traumatic, and they themselves could be at high risk of suicide as well, especially close family members. So it's so good to know that there are support systems to reach out to people like that. Yeah. So I'll move on to Vicky. Vicky, you have done lots of work with the corporate sector. Yeah. So please share with us some of this kind of work that you have reached, how you have reached out to corporate sectors.
So thank you. I think what VIESHAKA was saying before about making sure that family members and colleagues and those that are close to the person who's taken their life are receiving the support is really important. It is something that we have also done here in Japan, where there has been an incident where an employee has taken their life. We've gone in and provided that support. Because as you were saying, like CHUN, 1 in 4 people can go on to take their lives as well, from that were connected to that individual, from the feelings of guilt and confusion and loss that surrounds a death by suicide. Some of the things that have been we've been doing with corporates more recently has been talking about some of the other things that VIESHAKA was talking about before, was addressing stresses. And that's been something that has been really key at the moment following COVID. Right, so you've had a lot of stresses from maybe working at home, or worried about, are you still got a job, or particularly new graduates, how do I have that communication or know my role within a company? So talking about stress management has really been important. And then also we've been doing a lot of training, talking to managers, helping managers to recognize and understand, what does mental health look like? How do I identify somebody in my team that might be struggling with a mental health problem? How do I connect them with resources in my company? Because one of the things that we know here in Japan, and probably in many other countries, is that when an employee or a team member has a mental health problem, if it's not talked about, it'll take down the entire team. And so the productivity and the mental health and the well-being of the entire team can be affected. So helping the managers not only identify them, the people that might be at risk, but giving them tips in how to talk to someone who might have a mental health problem. And if they do need to have a break, working with them and helping the person who has the mental health problem talk through what is the best way to have a break, or get that support for counselling, or how do you integrate them when they come back into the workplace? When you do something like this, it is shown that you take down that risk of maybe a suicide or the mental health issue getting worse, and you're more likely to get your employee back in the workplace. So by not talking about it, we're not helping the problem, and giving managers and corporates tools to deal with it can really make a difference.
Right, yeah. Absolutely, I totally agree with Vicky. You mentioned about giving the tools to managers so that they can manage, and it's so important to address the stresses at work, because generally people spend most of their waking hours at work. Yeah, and Paul, I also understand that you have also, been invited to large international companies to do some post-vention kind of work.
Well, in Hong Kong, It's not actually not Lai Chung, it's not so common that the companies would do post-pension work for employees who have colleagues who pass away by suicide.
Mhm.
But it's people are getting more open about this, and I'm grateful about that, because if as you said, the employees spend a lot of time of their daily lives at work, and their colleagues, if they pass away by suicide or whatnot, that would influence their psychological health a lot. So it's getting it's getting common, but it's there's more room for improvement actually.
Yes, yes,
So yeah.
yes, it's heartening to know that there's so many initiatives and efforts to address this, with all the examples that you have given. We all agree that prevention is so vital, through the skills workshop you have mentioned, mental health training, EAP campaigns and all that. Much as we do our best, if a suicide unfortunately happens, it's so important to give support to those affected. Yeah, I'd like to have one last question for the panel. Very briefly, is what advice do you have for the other companies looking to tackle this subject in Asia? Let's start with Paul.
Well, thank you, Lai Chung. Actually, I would love to raise the awareness to the employers to openly discuss not just suicide, but stress, depression, anxiety, and all these issues related to work. And especially during the pandemic, we should be more proactive of providing the information and support to the staff. So it would be lovely to have like regular webinar during lunchtime that we talk about mental health issues. Maybe we can have some stress reduction workshops during lunchtime. And those are the things that well, I'm sure that the employees would get the information. But
Yes.
then the message is they will feel that the employers are actually doing something that they care about them. They are not robots and stuff. They are human beings. So that's something that I think the message should be put across to the employees.
Yes, thank you, Paul. Yeah, Vicky, just one advice.
I just think telling businesses and giving them good research and information and giving them that business cost will help them to feel that they can make a difference, right? That these strategies can make a difference. And I think when we're looking at the situation with COVID at the moment, we know that women are more affected, and we know that younger age groups are feeling more stressed. So giving businesses the tools and the information that they need so they can make good decisions.
Yes, yeah. VIESHAKA?
Quickly, I think we need to normalize the conversation around mental health and also suicide. I understand we specifically had this session because this is this is a dire subject. It's not comfortable with everybody. Also, in people's minds, sometimes suicide is age and life stage related. Like they think of certain people in certain life stages and ages who are more prone or less. Or, there are these stereotypes in our minds. I think we need to normalize also the fact that people at very different age groups, different professions, different life stages, different sections of society are, prone to have mental health challenges, and if not addressed, it could lead to somebody, passing away with suicide. So
Yes,
normalizing
yes.
the communication, mainstreaming the communication, and being very, very supportive, equipping people to have that conversation, not just pushing people to have the conversation, but equipping people to do do's and don'ts. Normalizing reaching out for help would, I think, be of paramount importance.
Thank you so much. Yeah. Right now, I have some online questions that come in. So we are going to move on to our Q&A segment at this moment in time. So, all right. Okay, there is a question here. VIESHAKA, in terms of preparation, what toolbox should workplaces have ready in case someone dies by suicide? Yeah, that's a question to VIESHAKA.
To ensure that your first support, which is your EAP, agency, they actually have packages or tools to to do interventions if required, team wise, to ensure that they have intervention. They're equipped to handle the situation with families, with your people, and they have the resources. Companies take different packages from EAP organizations. So that is part one. What we also did in our workplace was also to ensure that we had sessions, since last year, equipping our leaders and HR leaders to know what suicide prevention really does. One fine day you have an incident and you wake up and you do something that may not be very effective, because people are in the middle of different things and at different points of empathy in their lives, right? So I think equipping the organization over time, ensuring that your fallback, which is your EAP, is equipped. And of course, like we do on our internal websites, we have Headspace, but we also have equipped, tools on Spotify, etc., where people can reach out like easily. It's more easy than even calling a EAP helpline, finding out that number, etc. So ensure that you have like a web of an ecosystem around your colleagues to ensure that these interventions are easy to reach and accessible, and a lot of people are equipped to handle something like this.
Okay, thank you, Vishaka. Paul, there is a question here for you. You mentioned that you have conducted research on the triggers of suicide in Hong Kong. Can you share a little bit more about that and some of the key findings?
Well, thank you, Lai Chun. It's actually quite interesting when we did the study. We found that suicide attempt, people with mental illnesses are more prone to completing suicide. But one thing that we found that is quite unique in Hong Kong is people who have pathological gambling and debt issues and unemployment are more likely to completing suicide. So this is quite unique because in the past, before we actually did the study, it's always about people with mental illnesses and people who had attempted suicide. They are more prone to suicide. But then we found that actually the economy, the debt issues are actually pushing people to completing or attempting suicide. So I wish to raise this point, especially during this pandemic period, because we know that there are lots of people are laying off by the companies, and they probably they have a lot of debt issues too. So I would wish that the audience would think about if you are downsizing your companies, the mental health of your employees should be looked after. If your company unfortunately are downsizing.
Right. Yeah, that's so important. Yeah, recently I even heard a story of a man here in Singapore. He had worked 40 years on a job, but he was just given 2 hours to pack up and vacate his place. So that in itself can be so traumatic. There is another question here. Many companies shy away from this topic of suicide. So what is the risk of not addressing this topic? Can I ask this question to Vicky?
Well, the risk of not addressing it is you're going to have employees that are going to have an increased risk of mental health. You're going to have employees who are going to feel ashamed to step forward and talk about these issues. And as Paul was saying, it's not even just the mental health issues. It's about feeling that you can talk about maybe your long working hours or that work-life balance. So how do you decrease that absenteeism rate? How do you have an effective workplace, right? So I think it's looking at all of those issues. So not addressing it just increases the probability of the unhealthiness of your workplace and of less productivity.
Yes, absolutely. And that's when actually business would suffer. Okay, we have one last question. The question is, if we suspect a colleague might be vulnerable or at risk, what should we do? Perhaps some tips, even for managers or anyone around us. Any one of the speakers can address this.
I can go first. I think the first we start with the don'ts, because we've seen that some things we do cause more harm than others. Was one, to tell them that they are strong, they can get through this, that they'll be okay. So saying some things like this, and also offering advice on a situation. These are things that have been seen as causing more harm than not really providing any help. What we recommend is that people say things like, I'm here to listen to you, right? I'm here for you. I understand this is, I understand if you've gone through something similar, you can say that. If not, then you can say, I cannot totally understand because I have not experienced it, but I'm here for you. And please know that, if you need help, and even in a very inappropriate hour, I will be here, right? Ensuring that the person does their own research and finding out, let's say, be it an EAP system, reaching out to mental health professionals, or definitely ensuring that they point them to the right resources. I would just like to add one quick thing is, in the pandemic situation, I think, thankfully, this is being spoken about more. But like all of us who worked on the, this, health challenge, it is really about a lot of anxiety building up, right? In, more than a lot of other things. I see too many people around me talking about anxiety. So even when you see a person getting very anxious, please ensure that you tell them that it is okay for them to talk about it. You are here to listen, and point them to resources, especially equipped professionals who can help them.
Yeah, Vicky, would like to add to that?
Yeah, I think what VIESHAKA said was really key. Have the conversation. If you think that somebody may be struggling with thoughts of suicide, or you're noticing that they're not as well as they were before, you're concerned about them in some way, have that conversation. Don't run away from it. Don't shy away from it. Let them know that you notice that there's a change, and let them know that they're not alone and that you care, and connect them with support services, and make sure you stay connected and follow up with them, right? That conversation goes a long way.
Yeah, Paul, you'd like to just add one last word to this?
Thank you for that. Actually, I wish the employers acknowledge that the employees, they are the people that who are contributing to your businesses. So please take well care of them, and they are not your robots, and they do have their feelings, and they are the human resources that you have. So, and if you treat them well, they will pay back. So
Yes.
that's the most important thing that I do wish to share.
Yes. Thank you so much, Paul, Vicky, and VIESHAKA, for all your very insightful sharing of your experience, and from the different countries that you are in Asia. That was absolutely very insightful. And I totally agree with you. It's so important for us to start by talking about it. Yeah. Let me just quickly sum up our discussion this afternoon. We started off by discussing on the specific cultural sensitivities around this topic of suicide in Asia. So even though things have progressed, we all agree that there is still a road ahead of us in reducing the stigma of mental health issues and suicide. Mental health issues and suicide unfortunately do happen in workplaces, whether we want to talk about it or not. And we have heard from our speakers the reasons why it is so important from the business perspective to address this, and the cost if it is not addressed. So, but what is so heartening was the opportunity to hear from the experience of our speakers on the work, the initiatives to support prevention work, the mental health and stress-related training for leaders, managers, and wow, even stress checks for employees. Yeah. And Paul, you have also mentioned about the post-suicide work that's done for large companies. So we know that companies need to know that they have to have a plan and not react when something happens. Yeah. So with this unprecedented year of COVID crisis, with impending increases in unemployment and livelihood crisis worldwide, certainly still more needs to be done. and prevention, intervention, and even post-vention services should be more accessible to individuals, workplaces, and even communities. Thank you so much to all our speakers. That concludes our Asia program for today, but there are still more tomorrow, and the global program continues. The next session starts on the hour and is Thinking Differently, Neurodiversity, and Mental Health at Work. Thank you very much and see you again.